5, let me sure. What said it live?
What am I gonna do? Oh, let me send this to you. Hi guys. Coming out here, Sash.
You not hear me?
Sasha can't hear?
Yeah, you hear me?
No, I can't hear you.
Alright, hold on. Dean? Come here.
I'm not here. Sasha can't hear me?
Yeah, I
Hi
hear
guys,
you.
can you hear us?
Them not hear me? Dean? Dean?
Oh, no, we're muted. Hi guys. Can you
Oh, but
comment
they're
and
not
let me know if
hearing
you
me.
can hear me?
It must be on your side.
Oh.
Alright,
I'm
so
hearing
now
here. I
here,
know.
Sash. But it's not muted.
Oh, the host has unmuted here.
Can I hear you now?
You hear me now?
Cool. Hi guys, 1 second, 1 second. Oh, they said I can't hear both clearly.
I just mean here, Sash.
Oh. Christina, wait to the mic.
Turn up the phone.
The phone never turn
I
up.
think it's your phone. 1 second, guys. We're trying to sort this out. Technical difficulties.
Hmm?
The phone turn up, man.
That's weird.
We can't listen to this, so.
Oh, there's no feedback. It's not going to give a feedback, right? You guys aren't hearing a feedback, right? All right.
You hearing me now? You still hear me?
Yes, I can hear you.
Okay, great.
Oh, I know why. Maybe it's the speaker
The speaker.
that we usually bring around here.
No, I never plug in. You make the phone in and not even say no.
Guys, we're going to start in like 3 minutes. Look at such pretty face.
Hey, Christina, what are the extra needs? Yes, Dean? Eh? Alright.
Another minute and we will begin.
Technical difficulties.
I don't hear you.
Share the live, guys. Invite somebody. Like the live.
You ready?
You ready? Sash, you ready?
Sash, you ready?
Ready.
All right. It's 7:30. Go ahead, Nolan.
Good night, good night, good night. Guys, coming to you live again. Right from where we there? Coming to you in your living room, by your radio, by your TV, by your phone. Big up yourself. Thank y'all for tuning in. Tonight we got a special guest on the right side of your screen, I think, or on the left side. She has smiled, I know. we got Sashoie Grant
Mhm.
Bartley.
Mhm.
The amazing. She's gonna tell her story, guys. And you know, it's not my place to even jump in and tell the story, but she's an amazing woman right there. So you see, looking at her, she's an amazing piece of woman, and she's about to tell you all her
Pizza.
story.
Fuller.
Yeah. No, no, Dean not in the picture yet. Dean would be the fuller. Sorry, Asash. When Dean come in, then me I go say the fuller. But people, thank y'all for tuning in. Remember to like, share, subscribe, share it to your cousin, your friends, your family, sister, brother, everybody. Tell them to tune in. We got Sash live, and she's about to jump in.
Oh, and we have somebody that wants to say something. Come.
Yeah, I know a long time I don't see him. And him just did I eat ice cream.
I mess up himself. Come up here.
Say hello.
Hello. You have to come.
Let me see you.
Yeah, messy.
Say hi.
Hi,
Opinion.
what's wrong, man?
And what else you want to tell them?
Look up to the camera. See the camera there? And stop clapping at it something.
What else you want to tell them?
And to tell them to click that subscribe button and click the bell, click that thumbs up,
Why you look at me?
Yes.
and smash that bell.
Nice.
All
All
right.
right. All right. So guys, we appreciate you guys coming on here another night, another Sunday night to spend the night with us. And as Nolan mentioned before, we have Sashoie, Grant-Bartley with us. But for the balance of the night, I will be saying Sash.
Right.
Yeah,
Right?
for real.
All right. So for to start, we're gonna have Sash introduce herself.
Yeah, for everyone that don't know, Sash, tell us about yourself. Like, who is Sash? Or who is Nana? Which one? By the way, what name you prefer for us to call you by tonight? Sash, Nana,
Sash
Mrs.
is
Bartley?
alright.
Which one?
Sash is okay.
Okay.
All right.
All right, go ahead, Sash. Sash is a little bit nervous, but I told her that she got this, so she don't have to worry about it.
Okay. All right. Hi, guys. My name is Sashoie Grant-Bartley. I'm here to share my story with you guys. I'm just a regular young woman, you know. I enjoy the company of my friends and my family. My favorite hobby is eating. Um, my occupation is an accountant. I survive endometriosis every day, and I'm here to share my story, and hopefully it will encourage someone with what they're going through.
Okay, that's perfect. All right, so guys, basically how we're gonna structure tonight is we want Sash to get the opportunity to share her story. So there's going to be we're not going to ask as much questions as we used to tonight because we want her to share to not miss out on anything, right? But still, if you guys have questions, you can definitely post it in the comment section and we will definitely get Sash to answer those questions. All right. And some other comments. Hold on. Hold on. You have anything to say?
Sash, you ready? You're born
That's
ready,
ready.
you know. That's somebody just say you're born ready.
All right. So as you guys see, the topic is endometriosis, fertility issues, and premature birth, a testimony. So as I mentioned before, it's basically going to be like Sash sharing her testimony with us. And as she mentioned previously in her introduction, that she survives endometriosis daily. So to start, we're basically gonna have her explain what endometriosis is for anyone who's listening who might not be too familiar with the term.
Okay. All right. Before we get to endometriosis, it started in, I think, high school, where I used to have a very painful period. Painful to the point where I passed out twice from the pain. bleeding was ridiculous. And I would know that whenever my period is near, I just know say I can't do nothing, can't function. That's just it for pretty much the entire period. But in 2014, I was diagnosed with fibroid, but it was the size of it was really big. So I was told that I had to do a surgery to remove it. Before that, they gave me birth control in order to control the bleeding. That didn't do much, so we had to resort to the surgery. Around that time, I didn't have health insurance, so everything was pretty much cash. So we tried to try the public way because I spoke to my doctor about my situation, told her about the financial constraints, and she said that she would write a letter for me to get into the list at public hospital, Kingston Public Hospital. I think I waited 6 months to get to the top of that list, and that was with the help of somebody pulling a string for me. Otherwise, it would have been longer. So I had to endure all that pain and pressure until then. Finally came to my day to do the surgery. And I think there was one lady before me because there was a schedule. I think it was 9:01, and I was the 1 o'clock. When it became close to that time, I saw the doctor come into the room and was saying something to the nurse. And I was like, yeah, this look shaky. Then they came over to me and said to me that they had more pressing surgeries, life-threatening surgeries, so they have to cancel mine. And because they already have a schedule, I have to try to get back on the list. So me being a crybaby, I start bad, I start going, right? Because I said, I can't wait so long to get rid of this thing and only for here to me have to wait all over again. I was devastated and I cried the entire way home. But before that, the doctor that was supposed to do the surgery on me, he came and examined me the day. And he said to me that because of the size of your fibroid, it may create complications in terms of bleeding because my fibroid, it was bursting on the lining of my uterus. So he said that in the event that there's any complications, he's not going to try to find where the bleeding is coming from. He's just going to remove the womb. So I'm start bad, right? So may I say you cannot be so insensitive because everybody knows that the one thing I want to be able to do is to have a child.
Right.
And he had absolutely no sympathy. But I picked up my stuff and I left the hospital. And then I was talking to my family and I was like, I have to figure something out because I cannot go back down this road. And we come together, got the funds, and decided to do it private with my gynecologist. So the day of the surgery, she said to us that the surgery would have been maybe about 2.5 hours thereabout to go in and get out and whatever. The surgery turned out to be 7 hours plus. I was on the table for 7 hours.
Wow.
Because when they went in, they found out not only did I have the fibroid, I had endometriosis. So she was saying that was the reason for all the severe pain and the bleeding. So I was feeling pain and bleeding from the fibroid and from endometriosis in one. Because I passed out one day going home from work. I was in so much pain, and there was a gentleman on the bus. He saw that I was feeling uncomfortable, and I remember him saying to me, "What's my name?" I could not remember my name.
Oh.
He wanted my phone to get my password to probably open it. I could not remember anything. I think that was the first time. The second time, I think it was at my previous job. So no matter what pills I took, it never helped. It doesn't matter. The only way I get some relief is if I probably take more pills than I should, and it starts to kind of get me on a little calm for a little while, and that's basically it. So then by this time, I never know what endometriosis was. I don't know, not at all. Right. So when I woke up, I asked Shoya to explain it to me. That's another time when my brain fry and I can't process nothing really. Right.
Right.
So that was when I learned about endometriosis. And what endometriosis is basically the body produces hormones. And in the womb, you have something that you call endometrium cells. Whenever whenever your body starts to produce the hormones, those cells respond to the hormones by basically thickening in preparation to carry a baby. That's the only place that they're supposed to be inside of the womb. Whenever it realizes that, okay, we're not making a baby this month, it sheds and comes out in the form of your period through the vagina. With endometriosis now, those same cells that should be inside the uterus, the womb only, grows and sheds on the outside as well. So because there is nowhere for it to come out of the body, it basically builds up and it lodges at different sections of the body. And wherever it lodges, it creates um it gets the area gets inflamed and that causes scar tissue. So the scar tissue causes the inflammation and it causes the pain. And then those scar tissue now forms um, something that we call, what am I again? You know, like if you have a cut and then when it heals, it gets a scab. Right, those scab now form adhesion. And then what it does, it keeps building up every time you see your period. And then they eventually they might start to join some of your organs. So sometimes say for example, organ A, organ B, the continuous buildup of that eventually just comes in the middle and creates a bridge and join A and B. So there's no separation for them anymore. The most common areas where the endometrium cells will fall, the ones will be there, they'll form around the uterus, the abdomen, the cervix, the rectum, the pelvic area. But I've also seen red where it lodges other places of the body. Like I heard of a condition where somebody had it in the eye, the foot.
In the eye?
So it goes anywhere. And whenever you see a period, it sheds just as it's shedding inside of the womb. So that is what causes extreme pain, the unbearable pain. And the treatment for that, they might give you some pain meds, anti-inflammatory pain meds, or you can try birth controls, or you might can try the a surgery. I think it's called a laparoscopy. It's an incision through the stomach where they use electric signals, electric signals to get rid of as much of the buildup as possible. For me, I tried well, my doctor went in and tried to get rid of most of it as possible. And because of that, she said she would have suppressed my period for 6 months and then I should try to have a child after that because the cells will grow back. They'll get rid of it by doing the procedure, but because the cells are still there, it will come back. So
So
I
Sash, this
know
procedure
the regular
is it the
dosage for the
laparoscopy?
birth control is normally. Hearing me?
Yes,
Wanna
I
hear
can
me?
hear you. So the procedure, right? That they did, is that the laparoscopy?
For me,
Yes.
no, I didn't do the laparoscopy. They went
Oh,
in to
okay.
take out the fibroid. So when she went in, she saw it there. So she tried to get rid of it for me.
Okay.
Right. So the treatment for I got the depot. I was on the depot for the treatment, and I know with the depot it's normally you get the injection once per month, once every 3 months, something like that. But I was on double the amount every month because of how bad my endometriosis was. So because of that, I gained a lot of weight and hormone imbalance, um, breakthrough breakthrough bleeding, and it was a very stressful time. And I struggled a lot with dealing with the changes that was happening in my body because remember I'm coming from the girl who water could have colic in them place here, right?
Mm-hmm.
So the weight and everything wasn't something I was used to. And then dealing with um people response to it, you know, like people would be like, Jesus, Sash, the way you get big and fatty, you know? Or Lord, Sasha, where you make you big and fat so? And then people speculate and people assume and people don't know. And it made me realize that people go through things on a daily basis. People fight their own demons and you don't know. And sometimes just your response to such person, it can literally be the straw that really break that person,
That's true.
you know? And I had to, it made me had confidence in myself because I never understand everything where I go. And it's just everything just wake up one day and you just hear all of these changes, you try to forget for know more about it. And then not only did it take a toll on me emotionally, it took a toll on me physically.
Mm-hmm.
And then I had to get to the place where I said, it's one out of two things. People will be insensitive. They may come off as insensitive, but it's not always the case because sometimes somebody doesn't know. And if they knew about it, they probably wouldn't have said it.
That's
You
true.
understand? Because if I know you're struggling with something, Christina, I'm not gonna say it. Somebody else might not
Yeah,
know.
for real.
But on the other hand, you have to be careful of what you say to people because you never know what they're going through and the point at
Yeah,
which they are. You know.
that's true.
Um. After that, no. Right. So when I woke up out of the surgery, and she told me about the whole endometriosis thing and everything. Oh, the part of the reason why I was in the surgery for so long was because um I was bleeding, but she couldn't find where I was bleeding from. In those cases time they would just take out the womb completely, just like the doctor said at KPH. And she said she remembered how bad I wanted to have a baby. And it made me remember the day when I was at public and the gentleman said to me that if I have any complications, he is not going to try to find it. He's going to just remove everything. And I was crying and I was saying, look at that. If I did actually do the surgery at public, I'd still have the complications. I'd still have endometriosis. And I don't think he would have tried with me. And I would have gotten up without a womb and not be able to have a child. And I say this to say that a lot of times some things might happen to us and it may seem like a disaster at the beginning, but you don't know the plan that God has for you.
That's
Because
true.
I wasn't thinking ahead to think about, oh, I'm going to do the surgery somewhere else. Am I going to be all right? I was just devastated and the world just got end, basically, right? And it is important for us to remember that God has a plan and we just have to have faith. And it is so weird that when I got pregnant and I was supposed to do the first set of blood tests, and I went to Caledonia Medical, as I was sitting down, waiting on my turn to do my test, and you would not believe who stepped through the door. The same doctor from 2014 who said to me that him just got us remove move, just like that. And I looked at him and I smiled, right? Because I'm saying, what are the odds that I had this incident with this young man? And here I am today with my baby, looking at him,
Yep.
passing me. He doesn't remember me, but I will never forget his face. Still hearing me?
Yes, I can hear you. Is there a TV
Yeah.
like on in the background?
Is there?
Our phone?
You getting a feedback?
Yeah, I think I'm getting a feedback. I don't know if that's on
Or
our end. Could be on our end. Hold on 1 second. Sasha, can you hear us? Are you guys getting a feedback in the comment section?
yeah.
Hello. Say something again, Sash.
Can you hear me?
Oh, perfect. I think I figured it out.
You did?
Yup. Is there still a feedback?
All right, feedback gone.
Honestly, not
Oh,
hear the
thank
feedback?
you, Jesus. No, I think it was on our end. Is that better, guys?
Okay.
All right, you
Where
can
was
go
I?
ahead now, Sash.
On I am good. Okay.
Yeah, we're good.
Okay. All right. So I was under treatment for the endometriosis. So after that period, it was time to try and have the baby. Girl, I was trying and nothing was happening. I tried to get pregnant for 4.5 years and it just never did that keep, girl. Wasn't keeping. So I spoke to my doctor and she said I should try one more year. And if I tried and it didn't happen, then we could try to do some fertility treatment and stuff like that.
Mm-hmm.
So then by this point, I said, okay, it not gonna happen. And here's this theory about myself. You have 10 friends going bungee jumping, right?
Mm-hmm.
Think I'm back up. You have 10 friends going bungee
Mr. Sash,
jumping.
I'm back up.
And one friend, the
Mm-hmm.
rope pop, right? Everybody go all right. And the one friend, rope pop, I am that one friend, right?
Mm-hmm.
So, they say, oh, you still can't get pregnant. People have endometriosis and still get pregnant and yada, yada, yada. I said, I'm not going to be the lucky one. Because, as me say, the bungee jump, one person, right?
Mm-hmm.
So I said to the body, I said, listen, due to my situation, I don't know if I'll be able to give you a child.
Right.
So I think you should you know, make a decision if you want to go. I totally understand. Because hey, at the end of the day, most people want to have their children or child.
Right.
And I didn't want to be a factor that stopped that for him. So may I say, you can go. Well, if other good girls with good functioning body, can, it is fine. And he said, when we get to that bridge, we'll cross it. Because he's not going anywhere. So I said, no, sweetheart, let us cross the bridge. No, because if we decide to still do this thing together and you have a baby outside, I take the baby, I'm just going to kill you and she. So let us cross the bridge. No. Him said, I'm not going nowhere.
Good youth, good husband.
Stay with our Dean.
He, he had a lot more faith than I did. I think that was the January. It was January. He proposed to me after that, but I didn't get pregnant until about 3 or 4 months after he proposed.
Oh wow.
So me I said, all right, him look like him can work with because him never sure. But he still decided to stay so clearly and him decided to put a ring. So it's out of one of the two things. Either I'm really strong or two, him really love me, right?
Yeah.
One of the two. How I found out I was pregnant. You remember when Chantel come on the show and Chantel say the mother them, the praying mother them?
Yes.
Yeah.
Yes.
I was home one day and I say I was going through Instagram. What do you know? I don't carnival this one because for the past 6 years, every year, I say me I go carnival, right? I've been working on the body to go to carnival. Just for the experience. Because the truth is, with everything that I go through, the pain and everything that I go through on almost pretty much a daily basis, more of a try something outside of the box and to be able to say, oh, this day was a rough day, but I did something fun. So I said to Dean, say, all right, 1 year, I go bungle up all our friends them. Me I start from Papi in, I start from half a tree. And anytime we meet up, we just go home, right? So me I say, carnival, I'm not even know, so I found out about carnival the day of carnival, right? So me I say, you know what? Next year, nah miss me. Can't miss me. Some hear mommy say, don't worry yourself. I got carnival next year. So I said, Juni girl, how could have stop me from got carnival? Juni girl say you're pregnant, right? I mean, I said, what you? But no, some mommy always say things and it come to life. But me I say, all right, mommy, that one kind of far-fetched, right? And she said, no man, you're pregnant. But then me I look on the calendar, me I say, oh, but my period late for true. But I felt like I was seeing my period. I felt like my period was coming. But because I'm always in pain, I couldn't figure out if it was really the period or what mommy I say are true.
Right.
So I say, Dean, Johnny girl, so I'm pregnant. Right? By this time, I look on him face to see him reaction. Because say me ready for have a baby a long, long time. But he got to that place after me. Right? So me I say, but look how me I look on Dean's face, and if Dean's face not have no form of excitement, so look how me I go create excitement tonight. Right?
Right.
I say, you know what? I could go to the pharmacy. I say, but if I drive all the way from Mavis Bank Bush and go town to go buy a pregnancy. Listen, girl, I'm gonna tell you something, girl. The people them tired of me in the pharmacy. I buy a pregnancy test them a week. You know what I'm telling
Oh.
you? Because I was trying so hard, and then I realized say it was doing more harm to me than good. And you see that up something there, that fertility something they will tell you say, oh, you're fertile,
Yeah.
girl. I almost dash on my phone a couple times. But I have to just delete it because it never make no sense. No
Right.
sense. Every minute I check the app to see, when it start ovulate and it just never make any sense. So
Mhm.
I just decide to listen, I just gonna leave it alone and forget about it because the anxiety and the stress, it really can take a toll on your body.
That's true.
So I just decided to leave it alone. I'm just leave it alone. So now when time we go buy the pregnancy test kit, I'm telling you for buy one, right? Because I don't know how them, because I say I have no luck with them. So you buy it. Me I go in the car, go sit down and go and eat cheese patty and orange juice. Because me I say, you know what, at least we can get the news on a full belly because me can't take no more depression news on a hungry belly because girl, you know say I just eat that.
Right.
Completely eat that. So I tell him say we're not gonna check it until we reach home. Because girl, I'm not ready for pee that go. Ready. Ready
Mm.
right on a leg. So when I come home now and because when I did the when I was about to do the test, I gave it to Dean. So I tell him say him for do it because by this time I'm so my and them a shake like a leaf girl. Right?
Mhm.
Dean dip the stick, right? I'm gonna
Mhm.
there wait. I'm telling my aunt they right up in my shorts. Right up here, right? I'm saying Dean what the test say. What the test say. But Dean, very not so expressive. Just
Yes.
Laid back.
bland, right? So me, the pan a very high pitch. I said, Dean, what the test say? Dean said, well, you're having a baby. So girl,
Oh, D.
girl, I never know for do, I never know for believe me, I have to see it. I have to see it. Again, and when I go back to my doctor, I had to do the test again. I tell her, I said, I'm not sure, maybe something is wrong with the test before, because a
Mhm.
whole heap of time I go down the road there. Right? So,
Right.
I want to be sure. So I did two, I think two. And one day I go back at the pharmacy without telling anybody I'm buying next test because some never right, girl. Right? I needed to be sure.
Mhm.
So I'm gonna say, look, I'm really there try and still just by letting it go and praying about it and just kind of sort of just putting it at the back of your head, like everything will work out on it on
Yeah,
its own.
that's true.
I was even until this point, even though Boom Boom is very much here, sometimes still like me just can't believe. Like me can't believe. Right?
Mhm.
And you are sometimes at the place where you say, not that you're jealous of anybody, but when you see everybody around you having the babies and it is something that you
Yeah.
want, and you feel like your clock a run out on you, there's this thing that I call the good jealousy. So there's this jealousy that you have, but you're happy for the persons. But it's like you're saying, but I want it to me. You understand?
Yeah, for
Mhm.
real. The rope pop. That's
Right.
what happened. You feel like the rope just pop on you.
Okay. So
Okay.
we got to the pregnancy.
Right.
And I was thinking, like I'm gonna go through so much things. Because I had to deal with the pain. Because really and truly, pain for me is it's an everyday thing. It's just that it's at a different level on different days or different time of the month.
Mhm.
So, like 2 weeks before my period, I'm in pain. During the period is the worst time, and I'll feel pain sometimes after my period, depending. And remember, endometriosis it causes pain. It causes sex to be painful. It causes a lot of pain when you're seeing your period and you're urinating or you're passing stool. It causes constipation. Some of the symptoms of it. Some of the
Right.
symptoms, I should say. Right. Diarrhea, nausea. I had the pain, I had the constipation, and I had the nausea. I still
Mm.
have it, not had. But one day I'll be able to say had it.
Right.
So some days on a scale of 1 to 10, a good day is maybe a 8,
Mm.
10 being the worst. A good
Mm.
day is 8, 7.5. Because most times I'm pretty much not on the scale.
Wow.
It is crazy. There are days when I'd get up, my my mind wants to do things, but my body just say, no girl, have a seat. All right. And it makes you appreciate the ability. Like people should be able to appreciate the ability, to get up and say, tomorrow is a day I am going to work. After work, I go come home, I go do look house cleaning, I go do look cooking. To be able to get up and do that is a blessing because
Yeah.
some days I cannot. It depends on what my body say. I know I'm always seen as the chirpy person
That's
or
true.
the perky person. It was a choice because I can either be depressed about it or I can try to be happy about it. Because
Mm.
the reality of the situation is if I decide to move or to become depressed, it's still not going to change my situation.
That's true.
Yeah, that's
I'm
true.
not going to feel
Yeah.
pain unless, it not go ease up no local, nothing at all.
Mm.
And I I have the support of my friends and my family, and I have a mother who survived 2 strokes. I have a sister who fights lupus every day, and I watched her do 6 CXCs in the hospital because she was admitted around that time. So the energy around me, I have no choice but to push.
Right.
Because the thing is, the world is not going to stop for your pain. The world will empathize, but the world will not stop for your pain. So you either learn to dance with it, and I think that's what I did. We all have our demons,
That's
and this is just mine. We don't get to choose our battles, but we get the choice of how we choose to deal with them.
that's true. That's very
How we choose
true.
to deal. And for everything that I feel on a regular, it not make to me, it not make no sense to be depressed about it. Because a lot of the time when you have a positive energy about a situation, it makes it a lot more smoother
That's
to,
true.
to get through it. You
Right.
understand? Endometriosis might be my battle. Somebody's not able to physically walk. Somebody don't know themselves. So it is still something to be grateful for. And a lot of people doesn't understand endometriosis because it's not spoken about in enough as it should.
That's
But a lot
true.
of a lot of females suffer from it, and a lot of people go through and they don't check it out or find out how they can treat it or how it can make their lives better. Mine, as I say, I just choose to dance with it because I just think that that energy is what I need. And because of that, because of what I deal with on a daily basis, there are certain things, it changes my perspective on a lot of things and how I look at life. So it brings the topic of energy, and it brings the topic of the environment that you're in. For everything, every time I get up and decide to move, and my body say no. For every ache, for every pain, for knowing that I really want to get up and go downstairs and get something to eat, but me just know say I have to literally put my mind in the place to say, okay, Sasha, we'll get up and then we're gonna take one step, two step, and you know, it is a lot. So certain things I refuse to deal with. One of them things there is people with bad energy, girl.
That's true.
You see, anybody when I conducive to my health and my mental space and my sanity and my happiness, I am not afraid to cut you off. Whether you're a friend or you're a family. So you
Yeah,
can't choose family, but I can choose whether or not to deal with you.
that's true.
So if you are going to become a stress factor to me, like me think me go through too much, see, even try to deal with certain things. I always say for the things that I am able to control, I'm going to control it. I cannot control my endometriosis and make it disappear, but I can choose the people I choose to deal with, how I look at a situation. And toxic energy is another thing. You have people around you, not necessarily bad people, but them energy, it just toxic and it just so nice. Just
Yeah.
like, be careful, because believe it or not, we suck energy from people. So if you have a positive vibes, we're positive, you understand? But if every day you're just negative, 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 me, you know, but us vloops, I'ma just cut it off. I'm not shaking. I'm not shake, girl. I'm not shaking. For how I'm feeling. You see, days when time I'm gonna feel good, me have to talk to people who can cheer me up.
That's
I will
true.
Yeah,
admit
for real.
that there are days when I just completely lose it. Lose it, and may I tell you, say, you know, just bury myself in the pillow, I'ma just ball. I'ma call my sister them and ball. But on a larger scale, I try to be strong,
Right.
especially for the sake of boom boom. Right? Because believe it or not, we take a lot of things from our parents and the people around us.
That's true.
So I'm able to say, you know, Nana Grant, be strong, because you see your mother, be strong. You see your sister, be strong. You understand? We can't get up every day and just a mope and a go and then boom boom get big shag go say, boy, you know, my mother me get it from. Because you know, mommy, you always remember your parents and the things that you see them doing.
Yeah, that's true.
So I said to myself, say, if not for me, I have to do it for Soraya. No, girl, back to the pregnancy. When the
Right.
complications started, I think it was what, 3 months? 3 months in, I went to do one of the regular visits. And you know, she was doing the inspection of the vagina and thing. By the time she went in and come out, it was just all blood. So by this time, you know, say me lie down and me I look up and I see and I just start back and message Jesus peace. We go through so much things. I have one baby and then the baby just, I thought I was losing the baby. But you know, Dean over the other side, very cool as a cucumber and shake, right?
You know, it's always like that. The men, they usually have a more stronger faith than the
Right,
woman.
I think the men
right.
don't want to seem too weak as well.
You think so?
Yeah, I think sometimes we just don't want to seem too weak.
So you have to be strong, but in a little
So
bathroom want to cry on your own.
no, in a bathroom. What cry? Cry? Wait.
He
Okay.
had the theory that the two of we can't lose it and even I feel like um God would have give him a baby and just take the baby. So because of that, him just not worry about it. I
Yeah.
mean, I don't know how it work, but it works for him. But you know, so I mean him for Risha, right? As me ear, yeah, girl, as me ear. So what had happened was that my cervix was inflamed. And as you know, it is from the endometriosis because of the constant buildup. It makes the area inflamed. So now my cervix look like I'm ready for have baby. Ready.
At 3 months?
At 3 months, girl.
Oh.
So she's saying that she's going to oh, she said I should effective immediately anything that involves the vagina, vloops, and nothing. Okay? Nothing.
Looks.
Nothing until birth, right?
Right.
So she said if she would monitor it and if because she said it happens. So if it keeps happening, she's going to have to do the stitch thing to kind of keep it in tap. But because I was so inflamed and stuffed and mushy, so she said I wanted to do the surgery private, not because of money, but because I had a bad experience in the public system.
Right.
And may I say, the one doctor that was very patient with me, Dr. Sim Stewart, she's one of my favorite human beings.
Oh.
I said I prefer to work with her. And she said to me, she said, Sashoie, I know you don't want to go to the public system, but I think you should get registered at UA. Because the thing is, people will register at the private hospitals, but when you have complications, especially with the baby, they don't have a NICU, and U is the only hospital with a NICU. So what had happened is a lot of the friends, some of the friends I met, they were transferred from either Andrews, Andrews, and all those private places because the baby needed a NICU. So I got registered there. Went to do my visits and all that wonderful thing. But because of the risk, I started to see her more frequent than the usual time. But I'm not for that no. Oh. Also on Sunday I have my nice rice and peas. And you know me love a rice and peas.
Full of peas.
Full of peas, girl. More peas than rice.
Right.
Peas and rice.
Yeah, man. But I was having me even dinner alright and good enough, so me I go watch some TV show and thing. But then me I look at my finger, them start a tingle, you know?
Oh.
And me I say, did my finger them look weird to you? And then me say, no, them always look like ginger. But me I say, no, them look like worse than ginger. Right? Them look them look way fatter, right? So that you know like when you get gloves and you put water in it and it just start to blow up.
Mm-hmm.
Girl, I
Yes.
saw my finger start blow up in front of my eyes. And me I say,
Wow.
but something I keep, something is keeping, right? Some say no me jump from 0 to 100. I say, just guys, do you know what is what it is? It's a conversation, right? So me say, you know what? Check my pressure. So mommy had a pressure machine, so Dean went for it. And when him checked my pressure was, I think it was 150 over, I think maybe 70 something. But then when I tell my doctor, I know I have Dr. Sims on speed dial because girl, I don't shake, you know, anything I see when look shaky, me I call her, right? Within 5 minutes, my pressure jumped from 150 to 170 odd. Right? So me I say, something I keep, something I go on. Right? Then I called her and she said I should not panic. I should just go straight to the labor ward. By
And
this time,
you were in Mavis Bank at this time?
yes, girl. I was probably 20 something week, 20 early weeks.
So how much
26?
was that?
About
How
five.
much that?
I don't know.
Yeah, man.
About five.
No, man, was 6 something more.
Okay,
I
okay.
mean, I stick some mash. Well, I brush some. No, but just there brushing at the sticks, the middle part of the sticks.
All right.
So when I go now, I go labor ward and them check my pressure. Them tell me to sit down immediately. And they gave me, I think it was surfactant. Surfactant. That was for developing the lungs of the baby. Because when there's a possibility of the baby coming early, they give you that. I think it's 12 hours apart to help develop the lungs.
Oh.
Right. So me I say, all right, two little joke, and then we can go back home and thing, right? And then the nurse say, oh no, darling, you'll be staying here until you actually give birth.
Wow.
So remember, this was September, and I was due December. So now a piece of depression knocked me over, girl. So so I'm ready to start ball because as I quit my eye water there right on the eyelash. Right, so
Yeah.
ready. Always ready. Right?
Mm.
And she said, no tears, because if I cry, it's like affect my pressure and all these wonderful things, right?
Mm-hmm.
So me I say, remember me tell you how I try to look on things. This is a situation I have to deal with. So I have to try to find a positive side to it. So me I say, all right. Seeing as me I go there here for a very long time, might as well me just make this place my home, right? Because this is the new home, UA Hospital, right?
Right.
So I gave it a name. I call it the White Collar Hotel, right? So when everybody said, no, you're right, wait, oh, with the white collar, which one is it? And initially, it was very traumatizing because I found out that I had a condition they call severe preeclampsia. It is a pregnancy-related condition that is caused, well, it's a spike in your blood pressure. So that was why my pressure did just go sky rocket. And in turn, it can cause damage to organs in the body. I had damage to my liver and I had damage to my kidney.
Wow.
By this time, I have a pressure of 232, 240 over 120, some ridiculous pressure, right? And it was like that for the entire period. The pressure never start drop until after I have the baby. Because really and truly, with preeclampsia, the only thing that helps is birth. But because she wasn't developed properly, what they normally do is try to keep you as much to at least 30 weeks, 32 weeks, thereabout. So give the baby some time, some more time to bake.
Mm-hmm.
I was on 4 different pressure medication and the maximum dosage of each. I was on Aldomet, I was on nifedipine, I was on hydralazine, and I was on Lasix.
Wow.
Girl and boy.
You're done.
Girl. You see, when time I get the medication, the girl, I feel like me, I get mad, girl.
Oh,
Remember
wow.
one time I tell the nurse that please to come my mother because I eat this. I told that me I did in here.
Oh my
Like I take the medication and it's like the side effects is crazy. I mean, I said just don't give me none because I mean, no matter how much them give me, my pressure just not move. Still like two. The most it might come down to is maybe like a 210, but it's still over the 200s, right? So they kept asking. So some of the symptoms that associated with preeclampsia is like they call it now flashing lights, headaches, peony wally, them wonderful something there. But because me not the place so long, you know, every morning them come the rounds. By this time when them come on my bed, girl, I just start talk about my own conditions. I say, I'm save another time because listen, this is the condition I'm have. Okay, I have preeclampsia, severe preeclampsia, because you have severe preeclampsia, you have preeclampsia, severe preeclampsia, and you have eclampsia.
Mm.
They were watching me to see if I have eclampsia because the pressure that I was having, they had to watch to see if I was about to seize. Because with eclampsia, you will seize and like go into a coma, right?
Oh my
So
God.
because my pressure was around that side, they kept watching. So when they say, Sashoie, is there any? I said, no flashing lights, no pinwally, no headaches,
Mm-hmm.
no nothing, right?
Mm-hmm.
And I started to have edema because of the liver, because my kidney was being damaged. My body was retaining all the water. So I had gotten up to, you could come and it could sting your finger and it goes straight down in my foot. And I was like, I think I was 240 something pounds. I was unrecognizable. Like, all could never have nothing by me, girl. Girl, when you see me in that place, right? I remember some of my friends come to look for me and them pass the bed because my voice changed,
Mm-mm.
my physical appearance changed. I was so swollen that my eyes disappeared. Everything made it just look like a breadfruit. And my friend them come look for me and everybody pass me and say, oh no, no, sister, me there right this when I pass I go. No, see me. Right? And you know them are trying to make me feel bad. If daddy come look for me one day and daddy, him they look so frightened, I'm supposed to. You might try hide it.
Oh,
If I try hide it, but I understand. I
God.
understand. So because I was there and I couldn't go anywhere, I just make friend with everybody in that hospital. I just
Right.
everybody come in and everybody will start balancing me. I said, girl, no worry yourself. It's gonna be okay. Right? We're all gonna get through this. But you see, girl, you see when me see everybody come in, when me see everybody come in after me and go and left me in there,
Mm-mm.
depression, girl. I remember I could not cry, I couldn't do anything. Oh, I was also on a medication that they call um heparin for because I couldn't walk or I couldn't do much movement. They had to give me, it's an anticoagulant. It prevents me from clotting. But the side effect of it discolors your skin. So it just look like it just black and blue all over. All
Mm-mm.
over. And sometimes it would because I realized I started to bleed. So the area becoming in at 3 months me in the vein. So every day me get juke.
Oh,
So
wow.
eventually it was just all over. And they said to me, um, I had to do some blood tests, I think every other day because of my to ensure that my platelets and everything were okay. But I think one of the reagents that they needed to do the blood test, I don't remember what's the name of the blood test. You didn't have it. So we had to go to um the people in private hospital name again? Andrews, right?
Androsis. Mm-hmm.
So they had to take my blood and then we'd have to call Dean, Telefu Cinco, come my way, collect the blood, carry it go Andrews, wait for it, carry it back, and then some days, if daddy is nearby, I'd ask daddy to do it for me. So it was a lot of up and down, and it was just crazy. Then I think they said that because of my pressure and everything, it affected the blood flow. to Soraya.
Wow.
So her blood flow was absent or something like that. So she wasn't getting enough blood and all these wonderful things. One day they couldn't find her heartbeat and they had to give me oxygen. So I was on oxygen. Dean come the morning and it looked like it looked like him they have it together all the time. When him see me string up on the oxygen tank, girl. But after just tell him, say, go on, all right, man. Go on, because Mrs. Sam never had to do too well at all. I mean, I say,
Oh God.
before me start, boss. Make him go on. Because him normally come and drop off my clothes. Because, coming there so long, I forget new clothes, send home the old one, yada, yada, yada.
Mm-hmm.
One night I was sleeping and I just felt like I couldn't breathe.
Wow.
Like I was feeling so much pain in my chest. Like, girl, me I tell you say, and I eat this. I normally sing to comfort myself in the night when everybody, because listen, so when people come look for you, that's fine. But you see when time visiting hours up and the people them knock off the light on the ward and I just you with your thoughts and everything, it wasn't pretty. So I called for a nurse and they called the doctor that was on call at night. And I found out I had costochondritis. It's the inflammation of the rib cage. So if me do any form of movements and so, girl, me feel everything in here. So
Oh wow.
just a open up. Hold on, I almost keep on researching. So, girl, I'm gonna even tell about my umbilical hernia.
All right.
And she
Tell me
surgery.
about it.
The first surgery was the fibroid and the endometriosis. The second surgery was umbilical hernia. I had a hernia from a small. Hernia is basically a space in the around the belly button.
Mm-hmm.
So with endometriosis, I always have the problem of constipation. So the straining will sometimes cause, I think, the intestine to come through the little space there. But normally it was a simple thing to go back to the doctor and then pop it right back in, right? So I was at work and I said to my coworkers, I say, I don't feel right. I think I'll go to the doctor. And I said to Dina and Robin, because Robin was here at the time, I said to her that I go to the doctor because I not feel around my navel area, they just feel very warm and they hurt me. So I'm telling them to meet me up there. So I left work, walk go off a tree, push and also for go in a taxi, for go Papine, wait till how much in people, because the doctor in Papine, everybody from the Mavis Bank side, everybody up on the side, they come at the one doctor, say, the place full, girl. So when they wait until Dean and Robin come. So when I go, and him asks, so I'm complain, I'm gonna tell him. He tell me to lie down on the bed, he's going to examine the tummy. Girl, the same time the man touched my navel, girl. Girl, me wake up the whole doctor office, girl. Girl, I know endometriosis is a lot of pain, but I'm telling you, the pain I did feel. No, girl, I just eat. It was just eat. I just eat this, and he said to me that I have to do an emergency surgery right away because my intestines got stuck in the space and it's not going back in, and if it stays much longer it will cut off the circulation. I would explode and then Nana would just be worse, right? So by this time now me I say okay, because I'm not even gonna start process all of that. So this was a Friday evening night. But me I say me can't go you right now, because if me go you, I just nobody not gonna look for me. The weight and everything, I'm not gonna get looked on. So Robin said she gonna go up with mommy because daddy went to work and then say he will come with me. So go across the road. Me and my intestines stuck in my navel.
Wait, so after, even after he said that you had to do emergency surgery, you were walking?
Yeah, girl, come I forgot the doctor, girl.
My
I had to
God.
go to the hospital, girl. So we tried to get in a taxi. Girl, when we get in at the taxi broke down 2 times, girl. 2 times the taxi broke down, forgot after crossroad. When we go and reach crossroad and stopped at not all, they were closed. We tried to call on time. All of the taxi people them, nobody not answer, girl. So I start say, wo yo, Jaja. When so we have to walk off a tree. Come here, said the next hospital what me know about is Medical Associates. That was near, I think. So what if we walk go down where the post office there and try for charter one taxi for carry away out to Medical Associates. By this time, girl, I barely I make it, girl. Barely I make it. Reach and I went inside, spoke to the lady that was there doing her thing, and she said to me that I'm going to see a doctor shortly, but in order for me to secure a position, I need to pay some money. There, I had health insurance, but something was wrong with their system. Like at the hospital, something wrong, the machine they break down or something. So they weren't able to see how much I was able to the insurance covered for me. So I had to pay cash upfront. I think it was 102 some thousand. Yes, upfront in order to secure a bed.
Wow.
Well, Dean paid. Dean, because by this time now me completely lost it. Because girl, but just because from feeling a little pain to the pain getting severe, and for ear say, oh, I have to go to surgery right now. There is no two ways about it. There is no, you're not time for process nothing. Eh? So they said they're going to do an ultrasound to see how to get a better look at it. Right. So now, girl, we're going to the people in nice, cool ultrasound room, lie down on the people in bed and thing. And the gentleman started to do, look a cool something. Then the man just casually say, you have gallstones, right? So I start laugh, girl, because I start laugh, right? Because I didn't know anything about any gallstones. So I started to laugh completely. Like, I start laugh, I start bawling at one because me I say, me I think about everything, and me I say, really? Like, are you serious? And I said, no, I didn't. And I think, but they completely zone out after that. When they eventually did the surgery, how many did the surgery? Right. So they had they did an incision in my umbilical area, because really what they did is like the space that's there, they try to sew it so it becomes a straight line, so it closes the gap. Oh, I see. Because even now in my navel, you can feel the little knot. It is so weird sometimes. I'll play with it, but I don't know. But you have a little knot the same way, you can actually feel it under my skin. And because I had an allergic reaction to the anesthetics in my first surgery, I told them, and they mixed. I don't know what they mixed it with in order for me not to vomit, because I vomit. So when your belly water cut out for vomit, it feel like you trap everything will come out. Oh wow. So when I don't know what happened, but apparently they had some difficulty waking me up, right? And apparently they called in to try to talk to me to to see if I would. I think them they call daddy, but daddy never, dad not do too well with these things, right? So I was there and they was trying to talk to me, to kind of revive me. I don't know. I, I can just imagine how painful it was for them to go through that, because why I wasn't responding, I don't know why I wasn't responding. I don't know. I don't know. But that was the second surgery.
Mm.
And then, Sarai was the third. So the day when they decided that they have to take Sarai was, they came in and they said to me that she is not getting enough blood that she needs, and my platelets started to drop.
Mm.
And what that means is that um, it increases my chance. When your platelets drop, it increases your chance to clot, and it can cause bleeding. So they had to do a surgery right away. This was 28 weeks and 6 days, 20 some weeks. So by this time now, I said to them, I said to them, they gave me NICU therapy, where somebody come in and tell us that, oh, because you have you might be having a premature birth, this is what happens at the NICU, and something about, there's a risk that your baby will die, and something. Girl, by this time I just zone out the lady. I don't even, until today, I don't even remember that lady, because we couldn't even bother process that. Only thing we think you just said was something about some 25,000 deposit to secure one space or something like
Oh,
that.
yeah,
That was the
money
only thing I
part.
took. Right.
Mm.
So when they said that they're going to take the baby, me did start for comment, so she didn't need more time for bake, because she was small. She was small. And I called Dean and I say, because me and Dean did go and get the things for the, pack the baby bag and thing, but the only thing we didn't get was the Pampers, because it was finished. Eh?
Oh,
So I called Dean. Yeah, because premium Pampers is very hard to get, extremely hard to get. So I know she was going to come early, but I didn't know it was this early.
that early, right.
Okay. So I called Dean and I say, Dean, they might take the baby here. So see if I can get the Pampers.
People, one of the things that I love about Sash, the other day, right? Sash was telling me a story. And then, to me, the story sounds so painful, And then Sasha laughed. So I said, but it's serious, why you laugh? But you see, only Sash can tell her story the way Sash can. Sash tell her story with a smile, she laugh, and she cheery and all that, and I love that. I really love that about you.
Because I don't know what else to do about it. I don't know.
That's true.
But what I said to the gentleman that was there, he said that we have to take the baby now. Do you want us to take it, or you want your doctor to take it? I said, no, call my doctor. Make she come. No offense, but I prefer she, right? She know my story. Me and her go through hell and back. So I want her to do the surgery. But I asked him if he could give me any surety that me and the baby will be okay. And he said he cannot give me any promise. So I'm going on one surgery. Don't know if me I gonna make it or if my baby I gonna make it. By this point, I couldn't tell Dean. I never tell him, because me I say if him go come from we think of here. Me say Dean might not come out, or boom boom might not come out. That now got the situation. So I didn't tell him at the time. Right? And the surgery, when I was in the room, it literally, it was like some Grey's Anatomy setting, me, I tell you, girl. The big bright lights and the blue, everybody dressed up in a blue, and the place was just sterile. And me, I say, but you look like a movie theater, man. And them start laugh, right? She asked me to sit up because she was going to try to find my spine. That spinal joke, girl. And she looked at me and she said, Sashoie, how did you survive this long? Because my body was so filled with water that she had a problem finding my spine.
Oh
And me
my.
I said, doctor, do not give me no bad joke because listen, I have to walk and come out of this place because I have to go collect my baby and go home. Right? And she stick me and then she told me to keep moving my legs until I stop feel the movement completely. And throughout, I think what it messed me up as well was that I thought I'd be asleep. I thought I'd be asleep. I was awake. They don't no longer put you to sleep when they're doing those things. So I was very much awake through the entire um delivery. You know, like when you cut chicken and you punching that chicken girl, like my body was feeling the effect of it, but I wasn't feeling the pain.
Pain, right.
Right. And I heard when they said, congratulations, mommy. I'm here one like a squeaky voice.
That was free.
And may I say, I think they did bring her up to my face so I could kiss her. It was the most velvet thing I've ever felt in my life. And I didn't get to see her, but that was the only thing I got. And then after that, no, was all the excitement because the side effect of any surgery is adhesion. So I developed complications after they took her out. So my placenta got stuck to my uterus. So that whole excitement of um whatever they did to cut it off or to dig it up, it was crazy. So my doctor had said that everything was okay with the delivery, but my complications came after that. After that, no, I woke up and by this time now, three surgery, every time I wake up, I look at it like, okay, I'm alive. So it means that it is still another day for me to give thanks for. I'm not dead. So it simply means I'm not done with me yet. You
Right.
understand?
Mm-hmm.
Um, for the spinal headache, they told us to get Pepsi. I think that's how I got hooked on Pepsi. Girl, the caffeine helps with the spinal headache. Everybody come look for me. What you want? Oh, Pepsi. Girl, Dean call, what you want? Raisin bread and cheese and Pepsi. I'm telling you, so when I something when you come at my bed, Pepsi like nothing. And I still have a love for Pepsi because right now, girl, when I'm done, I go for a bottle of Pepsi.
Right.
And what I wasn't, the good thing was that after birth, everything started to get back to normal. Because with preeclampsia, severe preeclampsia, the only cure for it is birth. So when they took the baby and everything, I started to pass the fluid. The fluid where I was retaining in my skin. So I'd pee like every two minutes,
Oh wow.
and the pee would be like 2-3 minutes long. So girl, I'm not bother get up, girl. Could bother because for get up, the bathroom at UA was very low. And then with a C-section for bend and get up, the hardest thing ever. So by this time I just sit down. I'm not bother try act myself, and I just allowed the fluid to pass. The pressure was still high, but not as high. I was in the 190s. No, in the 190s. They said to me that I cannot go to see the baby because my pressure is too high and they don't want anything to happen. So I will have to send daddy to go and look and update me. Me can't wait for Dean, girl, because when him gonna work, me can't wait for him to come give me no update.
Mm-hmm.
So me find myself up at the NICU, right? And as me go, them send porter for me, call out my name, all sort of something. So Sean, please
Come
to
back
come
here
back on the
again.
ward. And me say, I'm saying them, me I hold my belly button. I just want to make sure say out at the front, the nurse them busy run at the back and them just go look on the patient and me just whoops. Me sneak out and go look for boom boom, right?
Right.
And I say, how is it? My child, right? Is going to be up there. And the other time I can't go up there. Them say I should wait on a porter to carry me in a wheelchair.
You know, so every
But
time you
girl,
say groups, groups come in at the comment section right on time.
man tell you man,
All right, keep going.
oh, me couldn't wait because then the porters, there weren't a lot. So remember say them I go from other ward to other ward, right?
Mm-hmm.
So when them used to, cause girl, I make friend with everybody, you know. So it's one time the doctor tell me, the nurse them say, oh, the porter will be in 5 minutes. Me call the porter. I say, porter, you there near? She said, no. I say, okay. But get up, girl. I'ma just trod my little self and go up at the NICU and go look for boom boom. Right? By this time, every nurse and doctor knew me, even when they never met my doctor and my nurse, because I made a lot of trouble on the ward. I mean, me did it for how long? Might as well me just make myself at home. You understand? And then you have some people, some patients that came in, they were really having a hard time. But because I was there, I know how it works. So, you know, I try to encourage some of them. And to date, I still have quite a few of them as friends.
That's good. That's
Still.
awesome.
Um, what I wasn't prepared for was what she would look like in the incubator. Girl, it's one time ago and see boom boom in the incubator. She was this small.
Mm.
She was 1.5 pound. She was 1.5 pound. And she did just string up. And the string them on me see, girl. You know, my create a scene in other people in place. Like it was crazy. Overall, Soraya had 12 conditions
Mm.
because of prematurity. I think I've written down some of them because them enough. Them enough.
Mhm.
The first one was the very low birth weight. She was really small. Like she was so small that when they put on the premium pampers on her, the pampers reach up as a girl. Straight up
Wow.
as. And she she was very pale. She was very pale because she never done bake, her skin did very thin. And you could literally see her little veins, and you could have seen the little heart a beat. You could have. It was very scary, extremely scary. So she had very low birth weight. She had which one again? Oh, she had jaundice as well. She had jaundice. She had to be on the UV light twice, two different occasions. Um, they were trying to decide if she had hypomotility of prematurity versus Hirschsprung disease. Hypomotility is basically because she's not fully developed, like the nerves in her stomach that would create the bowel movements. It wasn't fully developed, so she wasn't able to pass stool or pass air or anything on her own. So they were thinking it was that versus Hirschsprung. With Hirschsprung, there are some nerves that is completely missing from the colon. So they would have to do a surgery to test to see if it's Hirschsprung. But because she was so small, she was a less than a kg, and I think the required weight to do the Hirschsprung test is, oh, again, I think she had to be about 12 kg. So me I say when but we gonna reach so for them do Hirschsprung test on her. Right? So what they had to do was treat it like Hirschsprung. So every day, morning and night, we had to insert a tube in her anus to stimulate the nerve to to give her some release. So she would, and with the saline and the water and everything, it would just bring out the stool and release the air. So because she couldn't do that on her own, the stool would back up and her tummy would get distended from the gas. And in that period, they wouldn't feed, they can't feed her. What else she did have? She had a the retinopathy of prematurity. That is because she was on oxygen. Normally, when you're on oxygen for more than 28 days, it can damage your organs. So it had done some damage to her eyes. So we had to go to the eye clinic to do follow-ups to see if it's correcting or if they'd have to do um a surgery for that. Luckily for her, it corrected. She had absent hearing. One, because I realized that when she came home, and no matter how much noise they in the place, like she not, if she asleep, she not budge, she not jump up nor nothing. So me I say, oh, she look like she not hear properly. That was another side effects of prematurity, absent hearing, and they said that eventually it will get better. So I think we're going to have to go to the ear clinic until she's. I think the gentleman said until she probably start prep school or primary school. So at different points, like I guess every 2 months or so, we have to make an appointment to go there to the follow-ups. She had she had to get 5 blood transfusions because um she because she was premature, her bone marrow was not producing enough red blood cells. So her count would go very low, and the anemia and everything. So we had to get blood and all that wonderful stuff. She had what else? She had edema because because her kidney wasn't fully developed. You'd go today and her foot is swollen, or her face is swollen, or her hands swollen. Different parts of her body would be swollen. And she had um, coffee ground substance. Coffee ground substance is, in her case, because of prematurity, there's some bleeding or inflammation inside the stomach. And because it's not supposed to be there, they either vomit it up, or what they do is put a tube and it would come up through the tube. So we started to see the dry blood coming up. And what they normally do sometimes is give the baby cold saline in an effort to stop the bleeding. The most traumatizing one I encountered was when she had the apnea episode. Yes, she had an apnea episode. I go one day and I say, normally she started to feed. They started to feed her. So you had to look and you see the milk on the top of her incubator. I didn't see any. So I say, why them not feed her? And I found out that she had an apnea episode. Apnea episode is when you stop breathing for when you stop breathing for 15 to 20 seconds. And ta-ja, it had to do with there's a specific nerve in the body, that in the brain, that causes you to breathe continuously. But because she was premature, hers wasn't fully developed. So it's kind of like she forgot to breathe. So by this time, girl, go to the door, girl. I took the floor, say, there were no words. Like I just take the floor and I call my sister them. I'm telling them to find the first flight and come back. And I call Dean. And you know Dean, right? Very mellow, right?
Mm-hmm.
So Dean said, is she breathing now?
Dean.
Is she breathing now? So I say, yeah, she's breathing now. And him says she's going to be fine. Right?
Oh.
By this time, we call Junior girl the one piece of coballing. And then because I got discharged a couple weeks before her, but they were saying to me I should let daddy come. I should stay home and rest. I am saying, what is that?
You're not listening, though. You just go.
My girl. But just tell daddy, say, daddy, all right, Dean gonna work with the car. Start with the other little car because listen, I have to go for my one egg. One egg. I got one egg. And I gotta do everything in my power to make sure someone turn up for my egg, right? Come I've got to talk to her every day, Mr. Listen, girl, no bother we say that you have to get for breed something there. No bother excitement, girl, because me cannot manage it, right?
Mm-hmm.
But it was very bad for me because I didn't finish healing. And you know, Mavis Bank Road, I don't know, good road. So to drive that road up and down, my C-section started to bleed again. I had to go to the doctor again. But I'm saying, how do I not go to see my child? And remember, the health system out here is not the best. They try, but it's not the best. So some days you would go and you would see a little letter on top of the incubator with like a prescription. If it's urgent, they will call you. But if it's not too urgent, they'll put it on the incubator, like a prescription. So sometimes I'd go and say a prescription because some of the times UE doesn't have the drug, so you have to get it. So me can't wait pandin for left we think in a what o'clock at night to get the prescription for boom boom. So you know me start drive up and down, but because me call nobody not answer the phone them. So me they truly gonna chew half a tree, all of the place them wherever me need to find the medication so she can get what she need to get. Girl, I'm gonna tell you, when them finally let me backtrack. When they finally decided to let me out to go home. You see the day when them tell me I can go home? Because I said to them, say, listen, guys, I don't want no more heparin because me I want no. So my blood not go clot. So don't joke me no more and write it on the form. Say patient refuse medication. Me take responsibility for that. I don't want no more injection. I'm gonna tell them say if I go home and my pressure still now move, I will come back. Because by now I start get really stressed out with the environment and all these things. So I came home. No, when them times I can go home, girl, I'm not even wait. Girl, see him home in my nightie and my bed slippers. I just ask one of my friend them for a garbage bag. And I just lift up my hand and go so bloops. Clear up everything off of the bedside table. I just show it under my arm. I just lift. I say, listen, no man, somebody's coming for me. I never know what come for me at the time. But I say, I am ready. I'm ready. I never no change of clothes. I left CM way in my nightie. Go up on the queue and tell Dean I'm ready for go home. But him think I joke me did I make. But listen, I needed to leave that place. But when I did finally leave, I had a meltdown because now, even though I was at the hospital, I was with her. Maybe just a couple minutes away. No, but they're so far away. So I had conflicted feelings. And I don't know, I feel like I'm gonna get mad one at the time. Shai said I had trauma. Like I'd be home and like me hear babies in my head, I cry. I remember one night I got up about 2 o'clock. I'm gonna drive out of the yard. Everybody was sleeping because me couldn't. The cries in my head, them just never did I go away. Like would I just start tremble, would I just start shake, and it was crazy. I'm saying, no, I'm have to leave. I'm have to go look for boom boom. So the thing with the NICU is that when you're a mother or father, you get the privilege of coming um anytime. There is no restriction to your time. Apart from when the cleaning and so forth. Yeah. So I'm look on boom boom in that incubator with our little foot cock up and thing. And then when I left, when I say I drive up and down morning, I drive to morning, I drive to after 3. It's at 2 a.m. in the morning. And the cries them just never did I go nowhere. And I stopped, I think, at Gordon Town, and I parked at the side of the road and I cried for almost an hour. An hour. And then I came back home. And didn't sleep dead like a log. Him don't know what time I keep him. Just him never know what did happen. But there was so much things happening to me. I never know how to process it. I never know how to deal with it. Some days I have it together and some days I just completely don't. And I'm traumatized to the point where thinking of another pregnancy, my body gonna shock. My body just shock up. My mind shock up. Everything just shock up. It got overwhelming because I was saying, I go through pain every day. Some pain of some form. Of whether or not the endo pain or the gallstone. When I know that, because I think I damaged a nerve from the C-section. Because when it gets cold, like the cut, like it burns to one side, it burns, right? When I know that, as something else, and I'm like, when will a girl get some break? Like when will it end? You know? But I decided to be strong because even though she was really little, she was very strong. And she still is very strong. And if she can be so little and be so strong, then why wouldn't I be strong? You understand? And for days when I cannot be strong, everyone around me is strong for me. And it leads me to the point that your environment, your space, and your circle has to be the right energy.
Yep.
If it's not the right energy,
Bloops it.
cut it off. Cut it off. Sarah is okay today. How was she today?
Yes,
Yeah, I want to see a bundle of blessings. I think everyone want to see her right now.
That's if she not sleep.
Oh, she's probably sleeping right now.
I wanted her to look like me and take the qualities of Dean, because Dean is a better human being. I'm very calm and collected. I know me from 0 to 100, girl. I'm ready like tomorrow morning. I'm a full excitement and everything. But I got the opposite. She took every physical feature for Dean. And all of my excitement and me screaming and everything, she took all of that from me. So, but I think though, for everything that I've gone through and still is going through, she's like my gift, my compensation to say, you know?
Yeah.
Come, boom, boom.
We're coming through.
Say hi to everybody. Say hi.
Hi, baby.
Say hello. Say hello.
Hey.
And then you guys say what she says, how are you doing?
Wait, say hi.
Say hi. Say thank you guys for listening to my story.
She's so beautiful, guys. Oh my gosh.
Say bye-bye.
Oh,
Bye-bye.
bye, Riri.
Come take care.
Come.
Yeah. So that is my boom boom. I don't know what else I forgot to say, but
Sash?
mm,
I see a lot of comments in there said talking about a book.
Yeah.
When can we expect a book from you?
um, I work on it. I work on it. I gotta work on it. I know there's a lot of things I forgot to say, but I'll work on it. I work
No.
on it. True, true.
Oh, you know what I need you to tell us about? Nana.
What?
The
Nana.
foundation.
Like, tell us how you came up with the name and a wall.
The name.
Yeah.
The name is, well, it's my name, but I gave it a meaning. Um, Never alone and never abandoned, because there's so much people. Well, there's so much people that goes through so much nobody knows. So I decided that I wanted to start a foundation, a movement based on everything that I've been through and going through, in an effort to make somebody else smile, to make somebody else go through what they're going through a little easier. It's not formalized yet. I'm still in the process of formalizing everything, but as soon as it is down to the T, I will speak more about the Nana Foundation. But it is a movement that I want to push to touch the lives of others.
That's good.
That's impressive.
Yeah. And to be honest, like straight throughout the live, I was drying up in my nose, trying to
Yeah, me hear
hold back the tears
No,
because
me not try, because me I say the first time I come on live TV and Christina the man make my ball. Oh no, not at all. But
your stories are true blessing. And guys, we wanted to do it this way tonight because we wanted, Sash to share her story in its entirety, because there's a lot of women out there that's going through the same things that she went through, or is still like going through, like with endometriosis and stuff like
Yeah,
that.
for real.
And her
right.
story, huh?
Right. And for endometriosis, like there's a lot of persons that have it, maybe persons watching this live, but
Yeah.
you can feel free to inbox me on IG. I could share my ideas with you, because one of the things that worked for me is, well, it's not just for me, it will work for you if you try it, is dieting and exercising. So what you try to do is eat foods that helps with inflammation.
Yeah.
So, like vegetables, all the berries that you can think of, blueberry, strawberry, ginger, um, seafood, um, any food at all that helps with inflammation. If you include them more in your diet, and you exercise, it really helps with the inflammation. It doesn't take away the pain completely,
Yeah.
but it gives, if you're on a scale of 1 to 10 and you are at a 20, because you know the pain, even if you get on the scale and you're at a 10, it is still better than being at the 20.
That's true.
So you can try the dieting and you can try the exercising. So the dieting is practically, I just make it a lifestyle thing instead of um just a one-off thing. I do eat bad now and then, because girl, I love ice cream. I love all the things I'm not supposed to eat, right? But what I
Right.
try to do is, whenever I eat junk, the junk have to worth it. You understand? So if I go eat a double scoop of ice cream, it have to be Devanos. It can't be any other kind. So if I go eat anything where I go cause me any form of pain or inflammation, it just have to worth it. And if I eat ice cream this month, it's just once a month. If I eat,
Yeah.
let's just say once a month, I'll treat myself to something. Christmas is going to be rough, because with COVID and everything, I better go stay home and eat. And girl, I don't play with food. Some of them I go eat a whole heap of junk. So like after the Christmas, I have to go just do a cleanse to get my kale, my whole heap of bush, and start all over again. But there are ways to cope with endometriosis, and hopefully they'll spread more awareness about it. I
Yeah, that's
think
true.
I appreciate you guys coming in the yellow tonight. I'm not a color girl. I really don't do the color thing, but I did my nails yellow. If I not say it's yellow.
Yellow is for endo.
Yellow
No,
for
I said that
endo.
right. Yellow
So for
world. Let me
next
see. There's
year,
yellow hearts. There's yellow hearts, right?
yes,
Coming on now. Are there
Uh-huh.
yellow
Yellow
hearts?
hearts.
yes,
Oh,
yes.
and guys, there's a phone number going across the bottom of the screen. So if you guys want to take the opportunity to call to say anything to Sash, you can do that right now. Watch our face. So you can call. And I did see some a comment about has the epidural affected you in the long
Oh
run?
yes, girl. Yes, girl. Listen, you see the soda bending
Sort of bending.
are them certain movements.
Mm-hmm.
So that is my struggle. That is my struggle. So on days where I get, so with endo, it is 2 weeks before the period. I feel intense pain during the period, and maybe 1 or 2 days after the period. So that's a little break. Like me get a couple days break in the month. But then sometimes I feel like my pain them start take turns. You understand? So when the endo kind of cool down, the spine start going with itself. If I know the spine at the C-section are going with itself, or if me eat too much oily food, it affects my gallstone. So some of the time everything just come down in a one,
There's a
and then you
call
have
coming
days.
in.
Who that?
Hi, caller, you're live.
Hi, good night.
Good
Good
night.
night.
I'm calling from Jamaica. My name is Siobhan Walker.
Oh, Chevy.
Just calling to encourage. First of all, I love the program. This was very good. And I know it was very uplifting and encouraging to a lot of people. They just wanted to call. So, big up Sash and big up the program and just encourage Sash to one, or if I write that book.
Yes.
Yeah.
And encouragement and inspiration to a lot of people. And a lot of people are watching and they're inspired. I know that God brought her through this, not just for her, but for everybody else who will go through this,
Yeah.
who are going through this. Be encouraged that you are an inspiration, girl, to keep on doing what you're doing.
Absolutely. Love that. Thank you, Siobhan.
All right.
Sash?
Thank you, Siobhan.
Hi.
Chevy, as Sash say. Chevy.
Yeah.
All right. Thank you.
Thanks.
All right. Take care.
All
All right, you
right.
too.
So there was another call coming in.
Chevy, come
Hopefully the
on.
person will call back, but okay,
Oh,
there
yeah.
it is. Hi, caller, you're live.
Oh, it gone.
No, it's
No, I think the call dropped.
call drop.
Oh,
There
it's
it
coming
is.
again. One more time. Hello? Good night, good night, good night.
Hi.
Hi, guys. Good night, love.
Good night.
What's that? You extra?
Oh, she's not here.
Hello?
Yeah?
Nana.
Yeah?
Girl, I just want you to know that you're very large. You're very loved. Girl, I'm crying.
I love you too.
I'm crying.
Mm-mm.
You cry?
I know Nana for a while now. She's very supportive. When me mean say every little thing Nana called me, so Chantel, all right, this morning, I took the opportunity of giving her a tour going on to the COVID ward, and Nana going with her bag of excitement.
Yep, that's Sash.
She cannot help herself, and I just want to let her know that I truly appreciate her friendship. I am just grateful that I never missed her life, and God the light I made it back.
Oh gosh,
You say what's a piece of something, girl. Girl, don't talk too quick. Don't talk too quick.
I don't know it. I know I work with these kind of patients and everything, but a mother going through all of this, I don't know if I would have been so strong.
Yeah.
So listen, girl, keep smiling. Keep being chirpy. I look forward to always hearing from you in the morning. Keep sweet, darling. Chrissy and Nolan, you guys are doing a fantastic job.
Thank you.
Thank you.
I'm going to be always tuning in. Big up on a nice good self.
Are you too, honey?
Guys.
Thank you.
Thank you.
Alrighty.
There was another call coming in. I think we're gonna return. Oh, here it is.
There's another new.
Hi, caller. You're live.
Good night.
Hi, good night.
Good night.
Hi, so I'm calling from Dominica.
From Dominica.
Yes, I'm actually married to Shoy.
Oh,
yeah.
Hi.
How you doing?
Ashley, good.
You know, this was hard to look at because I have known Sasha as the bubbly one. And, you know, I think she brought up well, secretly tears rolling down from my eyes because, you know, it's hard to see someone you love go through so much.
Yeah,
and,
that's true.
Sasha is extremely strong. And I'm thankful that she has Dean by her side. I think he's a blessing. You know, I really want Sasha to know I love her and I appreciate her.
Aww.
And I really wish the best for both of them. And her story is really an inspiration to me personally. And I know to many other people out there. And to look at Riri the way she is, you know, sometimes Sash would send me little videos with Riri, and she's so exciting, just like Sash.
It's true. It's so true enough. It's true.
Mama tell her no. She take all the excitement.
Blessing, you know. And I really want to encourage Sash to keep doing what she's doing, and you know, just keep the faith. God is going to work this out.
Amen.
That's
Definitely.
True. That's true.
Thank you. Thank you,
welcome.
Ash.
Thank you, caller.
Love you, Sash.
Love you.
Oh, look at our little face. All right.
All
I
right.
think there was. All
All
right.
right.
Good night.
Thank
There was a New York. I think call about the number no man.
New York. I work out from New
I'm
York.
not sure about the number.
So she said, what call from New York? Let's see if it's gonna.
Ringing. Good night. Good night.
Good night.
Wait, it's going slow because I'm hearing Ashley on my TV. Okay, so let me just talk. Hi, guys.
Hi.
Hi, Nana, darling.
Hi, Kim.
Actually, I don't hear the TV because the TV in my background. Sorry. Yes. So, guys, I must say, I met Nana through a mutual friend. And I've only seen Nana in person one time, but Nana is my personal alarm clock. We talk every day. There's not one day that we don't speak. Nana, I just want you to know that I love you. You're very strong, and I admire that about you. Nana is my personal psychiatrist.
It's true.
I don't know what to call her. Thank you for my bad baby. I love you so much. I love you, love you, love you. I'm really can't wait to meet Riri.
It's
true. I haven't met her yet.
Aww.
All right. Thank you, caller. Good night.
I think there was an. Oh, okay. There's another call coming in.
Caller, good night. You're
Good
alive.
night.
Thank you, caller. Good night. I think that was on. Okay. There's another call coming in. Caller, good night. You're alive.
It can turn down the It can hear us. Turn down the live in the background. Hello.
Hello.
Okay, so we're not hearing anything.
Hello.
Oh, hi.
Good night.
How are you doing?
We're good. How are you doing?
Yannick, you can hear us?
I can hear you.
Okay, you can go ahead now.
Oh, that Yannick?
I'm so inspired by her story. She knows this all the time. And, you know, we were all by her side from a distance, praying every single day, wishing that, you know, this would happen for her. And we know when she had the first surgery, Antoine and I were all saying, God, it's 1 year. She'd have pregnant it. Jesus Christ.
come through and that
Yeah.
to have a baby. She said she don't have nothing else than just to have one baby.
You sure?
We pray, we cry. When she got with her, she was pregnant. Everybody was just excited, dancing, clapping. We knew the road wasn't going to be easy, but we were excited, and she pulled through because she's strong. And God doesn't give anybody nothing more than they can bear, and they know God gives it to Sash because He knows that she can bear it.
That's
and she
true.
can carry it. And she carry well. Look on her big stage. She carry it really well.
That's true.
Two come to me dance. Don't worry. Two come to your
Thank you,
All right,
Eddie.
thank you. Good night.
Was there another one? I think there was another one,
I
but
think there was
hopefully
a
they'll
Jamaica
call back.
call coming in.
The people, I'm serious, man. People bear credit.
Such that you're loved. And to be honest, your story is really and truly an inspiration to a lot of people. Because I know there's a lot of women out there that's trying, to have a child and nothing is working. And, so if you had one thing to say to those women, what would you tell them? Not just one thing, but if you had something to tell those women who are, struggling, or not just the woman alone, because it's not just them. There's the men that's beside them too, going through it as well. So if you had anything to say to a spouse, a male or a female, what would your word of encouragement be?
I would say.
Hold on, I think there's a call coming in. But I want you to answer the question, okay?
All right, girl.
Hi, caller, you're live.
Hi.
Hi.
So, this is Shoya.
Hi, Shoya.
Miss Sun. So me I want you to tell me, I say, just like, now go make my ball tonight, do
Girl, your ball.
now go make my ball, I'll tell you. Like, so many things. Like, a lot of times I've spoken my story, but it's the first time that I actually sat down and listened to somebody that I love tell their story like that. And Jesus is hard. Me I said, Jesus is so, it's hard for me to tell them when me I tell my story. Jesus. It's hard,
Yeah,
because
sure.
even though Sash gave a part of her story, you don't even know the half of it, right? The half of it. A lot of times people say I'm strong, and they don't know it's because she's my sister, and she's always there. I mean, like, this is the girl that stopped going to school when mommy got sick so that her younger sisters can get an education.
Wow.
That when she can work as a teenager, right? So that we could go to school, right? So this girl has sacrificed so much. So all the blessings that she's reaping now is because she's so deserving.
Yeah.
And I love my sister so much.
Shy, I don't know about.
Yeah, man. But let me tell you, man, that is a our strength, and all of us will say that, like, she has second man and everything. But I saw her fight and go through, and I'm so proud of her. A lot of times she don't even feel like she's where she's supposed to be, but we are so proud of you. All of us, me, Munchi, Jody, Betty, all of us so proud of you. We're so proud that you're our big sister, and I love you. God, so bad when I only love you, please.
Girl.
And by the way, guys, Shoya will be coming on too in December 13th. So make sure you guys are ready for that one.
Yeah.
Yeah, make sure y'all are ready.
Period. Bloops.
All right, bye.
Bye, Shoya.
Bye.
All right. You can go ahead now, Sash. I think there was another one, but they'll call back.
I would like to say it is important for you to have the right energy. I know what you're going through is difficult, but having the right frame of mind, a support system, a partner who is supportive is very important, because you don't want to be involved with somebody that doesn't give you the push that you need.
Yeah.
Understand? And also for the male, you have to understand that what she is going through is pretty, because you have a lot of guilt to feel like, you're with somebody and you cannot give them this, you struggle with that. So it is important for you to understand. Basically, it is important to communicate, because I always say one of the biggest problems we have with any relationship or friendship is communication. We don't communicate. So I might be having my feelings about a situation, he might be having his feelings, but we don't air it. So he doesn't know how I'm feeling, and vice versa. You understand? So one person doesn't feel like, oh, he's completely shut off or I'm completely shut off. It's important to talk, because I make sure I air it out. There's no room for any wondering. I said, listen, I don't know if I can. What do you want to do? You understand? And he'll say, whether he wants to stay or to leave. It's important to be supportive, and you can get help, because some people have conditions and they don't find out about it. They don't educate themselves about it. Once you educate yourself about it and speak to your doctor about it, they can channel you, to the right directions. And then try not to be anxious for those who trying to get pregnant, because the anxiety is something that is very real. It is very real. And always remember that we don't have the same timing. My timing and your timing is completely different. My timing might be to have a child at this age, but yours is probably way down the line. So you just need to pray, be hopeful, and just surround yourself with the energy and the environment that does more good for you.
Awesome.
That's true.
There was a number that was calling from Jamaica, but we missed the call. And we can't call back with this phone. We can't call back Jamaica number straight. So we were trying to look for you on WhatsApp.
So call her with the...
Oh, there's another call coming in. Hi, caller. You're live.
Good night.
Oh, he hung up.
I think
he'll probably call back.
He's calling from the US.
But the call that was coming in from Jamaica, you guys can call us back, okay? Because we're trying to call back from WhatsApp, but it doesn't look like the number is on WhatsApp.
Yeah, the phone number ending in 1964.
Say again.
Oh, we got the...
Hello?
Caller, you're live.
Life for the greatest, man.
Life for the
That
greatest.
sound like Jay.
Of course, that's Jay. That's all he said.
And him gone.
That's all he said.
Sasha, you know differently. Like during your story, I know you mentioned that there was a song. There was a go-to song that you sang. Yeah, I want to get deep. I want to dig deep. I want to know that song. I want to hear that song.
No.
And I'm pretty sure that everyone in here want to hear that song.
Yeah.
You want a mic?
You want
a mic? You want a rhythm?
What was the go-to song? Sing it, Sash.
My go-to song. Oh, yo.
Trouble?
Like a ship sailing out on a trip so rough and long, so far from shore, so far from home. I sail out in search of a reason to go on, and there I find him in the eye of the storm.
If you're at home, you can just sing wherever you're at.
No matter what storm clouds may rock this ship of mine, The light of my Savior will lead me safely through the night. And though my ship may be rocky and my sails, they may be torn, I shall rest in the eye of the storm.
Amazing, Sash.
Beautiful,
my
beautiful.
God. Beautiful.
Oh, yeah.
I didn't know there was a call coming in. We can call back this number. It's a Canadian number. Let's see if it's gonna go through. All right, people. You see with the phone that we have now, you can only call back on WhatsApp. And if you're calling from the US, you can only call it back straight because this phone is a stupid phone. But caller, you can call back, okay? Let me see. Let me look at some of the comments. Somebody says second verse, man.
Somebody need a second verse.
Oh, our God is awesome.
Second verse.
Amen. Oh, you know what? Maybe we could try calling, save this on WhatsApp to see if we can call back.
Second verse.
Philip, we said yellow hearts. Why is your hearts black, Philip?
Same careless, man.
Because in black, man. Because in black.
Oh, and Sash, to be honest, it is such a pleasure to have you on the show tonight. And people, remember telling me, I have a big Sash.
Oh, yes. This was like a 2 weeks worth of begging.
Yes, 2 weeks worth of begging.
Because, no, I will tell you, because I'm not the public speaking, I'm not the upfront. I'm kind of the behind the scenes kind of girl. So this open on the camera and people are looking at all these bag of things. Chantal, I'm still up for the Pepto. I just want you to know that.
Oh, you never get the Pepto?
But when she was
Chantal never carry it.
When she was... Oh, here's the Jamaican number calling.
Jamaican number calling.
Hello,
good night, caller.
Good night.
How are you doing?
Good. Girl.
Oh. Say girl again.
She said say girl again.
Sash?
Yeah?
Bug light.
Bug lights. Which one are the bug lights? Nash? Anash? Natalia?
Hello?
Hi. Oh, wait, she's...
Hi.
Can you hear?
Nash.
Yeah? Nash! Goodie.
Yes. I know Miss Cut watching, so on behalf of everybody there, we know you're strong, we know you're brave, so keep doing what you're doing, and we are proud of you, okay, girl?
Thank you.
Aww.
All right, baby, bye.
Bye.
Thank you for
calling.
All right.
Well, everybody just nice.
And you see, the thing is, so there's a delayed. Oh, Munchie, call back. Munchie, call back. Munchie, on WhatsApp. Then.
ZB Mama Lord
Ready?
Connect proper.
Call back ZB Mama Lord, please.
They should not sleep all them.
Jesus, please.
Hi, honey, how are you?
Hey, yo.
Ruby!
One time, I said, yeah, man, I signed this, but not for call. But anyway, Sasha, you hear me?
Give me ear, girl.
I just want to say that I'm super proud of you. Like, I don't know, Sasha dark. Sasha not talk to people. She not go on live and do them something here. People call her and she look on the phone and watch it ring. That is how bad she is. And the fact that you are up here doing this, we're not even talk about your testimony, just the fact that you overcome all of your, everything we need to overcome to come on the live tonight.
Yeah.
It's just indicative of your strength, and I'm just so proud of you. Okay?
Okay.
Aww.
You can't sing the song, so sing it.
We're gonna sing it, you never hear.
Wait, that gone?
Yeah,
You might
girl.
hear it because it's
Yes,
kind of
girl.
delayed for some people.
Yeah, the
So you
lady.
might hear it afterwards.
Yeah, man.
Okay,
Yeah.
okay, all right.
Unless you want her to sing it again.
Oh. Yeah.
No, it's okay, it's okay. Nobody stress her so much.
That's true. Thanks, Uche.
Yeah.
All
All
right,
right.
good night.
So this is what we had for tonight, and Sash, we truly appreciate you coming in and sharing your story with
Mhm.
us, and like it was truly an inspiration and a blessing to me, and I know that it was an inspiration and a blessing to other people as well.
I hope so. I hope so.
Sash, you see, oh, life for the greatest again, Colleen. Caller, you're live.
Phenomenal speaker.
Yogi! Yogi!
Definitely, right?
This is Jay.
Oh, Jay. I
Yeah.
want to tell it to you. Hi, Jay. Same thing.
We have to commend you.
Oh, thank you, Papa.
It's amazing to hear you talk about so many stuff. I mean,
Yeah, it's crazy.
if after your like one reason and believe that there is a God, maybe they just need to wake up.
Yes.
And it's never hear so much miracle. Not even at the Bible me hear so much miracle. I mean,
It's
it's
true.
amazing. I'm not gonna lie. Real talk. God bless you, girl. Life for the greatest. You know what I mean?
Yep, definitely.
Yeah, true.
Oh.
Thank you for listening.
I was gonna say something, but I forgot what I was really going to say. But it will come to me. And guys, make sure you're following her page because her foundation. I think like when she explained to me the reason why she's doing the Nana, what's it called again? Nana Foundation.
Nana
Never
Foundation.
alone, never abandoned. It really
Right.
moved something inside of me, and I think her initiative is really a good initiative. So you guys make sure you have Instagram, right? With the
Yeah,
Nana
she
something.
does.
Yes,
Yes,
girl.
girl and boy. But guys, make sure you follow her on Instagram. Sash.
And
Yeah.
we're looking forward to seeing a lot more out of the Nana Foundation. And probably a lot more lives and some public speaking on some big platforms. Definitely looking forward to that. And we appreciate you spending the Sunday night with us. Definitely
Thank you
appreciate
for
it.
having me, guys. Thank you for having me. And thanks to everybody. Well, click the link and sit down and watch and them excitement there. Like for taking the time to actually sit and watch it. I appreciate it. I
Yeah.
appreciate you guys. I'm
And
not gonna bother
guys,
to just be alive.
guys, if you're new, make sure you subscribe to our channel. Hit the like button on your way out. And guys, this is something that we want to do because our thing is we're not so
Oh,
big.
here's a
Oh, there's a number coming calling.
Eh?
Philip.
caller. Good night. You're live.
Good night.
Last minute everything, but I have to say that we are talking, right?
Sorry.
She look like she
Yeah.
confused.
Yes, girl.
Oh, she figure it out.
So I just want to say, like everybody else, I'm super proud of you, Sash. You have been through so much, but always remember that God gives the strongest soldiers the toughest battles.
Yeah.
Okay? And I also want to say that during that time when Sash was going through all that she was going through, she was still checking on her friends. Girl, you good?
It's true.
And I'm gonna say, you asked me if we good. You alright? I'm very good, yeah.
It's true, that's Sash.
She's always just taking things so
Yeah.
even when he shouldn't. And your strength is truly admirable. Sometimes I'm pregnant right now, and sometimes I go through some little pain or something, and I say, life is hard. Why you want this? But when you think about what other people have been through, it's like you just have to give thanks push by you there and your little struggles, because people just really have got through worse than whatever you're going through. And we still have life.
Right.
Life is
And
here.
for the girl too?
We're all
Right.
happy you're still here. So the journey
Too.
continues.
Definitely.
Thank you.
And
Thank you, Sugar.
Thanks for calling.
Eh,
Oh, you know what I wanted to share before we finish? When I shared the photo to Facebook, right? And I looked at some of the comments and some of the people, not comments, some of the persons that liked the photo. I had to tell, I think I told Nolan. I said, Nolan, almost 85% of the people that like this photo, they're male. And it's not that they don't read what's going on because they know what it's about. But to see that, we have some men behind us that, that's encouraging us and, motivating us. Just like Dean, he's there for Sash from the beginning.
Yeah, shout out to Dean. Shout out to Dean in the background.
Yeah.
Dean, we know you're here. Shout out to Dean.
Put your face in the camera so they can see who Deanie Boo is. That's
All
Deanie
right,
Boo,
that's Dean. That's the guy that never left. He stood with her straight
Strongly
up.
satisfied.
Oh, and guys,
Never left and will not left.
Exactly. Dean is like yesterday little introduction video where we're having with something.
Oh, in the YouTube videos.
Dean was the one that kind of put that together for us. Yeah. Dean is kind of like the personal photographer. Anytime I go to Jamaica and I want any photo to be taken, I link Dean. But he has Instagram, he has YouTube. What else do you have?
Everything. Dean Bartley. Just type in Dean Bartley.
And you will find him on Instagram, Facebook, YouTube. He's one of the wickedest. And
even the photo in the flyer was Dean's photo.
Oh yes, that's true. He took it. Yes, he did. But Sash, you have any parting words to say before you go?
Parting words. Life is beautiful. In spite of what you're going through, life is beautiful. Every day, standing on top of your grave is a blessing. And you need to think about it, evaluate the people around you, your energy. And like I said, if there's somebody or some bodies that doesn't contribute to your well-being, your progress, your goals, and your dreams in a positive way, vloops.
Vloops.
Cut them off. Right? Cut them off.
Like the vloops. Vloops are going to take over. For shame.
Oh, God. Nolan. Do you have anything to say before we go, baby?
Sasha, I want to say thank you. You're a phenomenal woman. Definitely someone that shows.
Why my cheek them feel red? Let me tell you.
You're stronger than a lot of guys out there. To hear you even say you're walking like down halfway tree, knowing everything that you were going through at that time, that's the definition of true strength. That I think that's why Shaggy sang the song like the strength of a woman for real. Could have never.
Yeah, strength of I don't know how I get through it. I think about it sometimes. I'm gonna try to figure out. But
sometimes you're in some situations and you pull on like an inner strength, and you even surprise yourself because you're like, boy, I'm really.
Yeah, and then right, and then I realize that you have to be strong for you because people can be supportive. People can be supportive, but if you don't find that strength within yourself, then you're just not going to keep. So you have to be strong, if not for anybody, but for yourself. Because as I say, The world is not going to stop turning because you are going through something.
Yeah,
They'll empathize, but the show goes on with you and it goes on without you. So you just have to make a decision.
mm-hmm.
And
That's how it is.
dance with it. I like
Dance
the
with
way
it.
you say you just decided to dance with it.
Dance with it. And some days when you keep me down, you just keep me down, but it not keep me down for long.
That's
It not
true.
keep me down
Yeah,
for
you
long.
get back
Yeah.
up. That's the reason we fall, so we can get
Back up,
right back up.
yeah. And guys, if you're watching and you have any story that you want to share and you want to be a part of our life, you can definitely reach out to us. That number going across the bottom of the screen is the number that you can text us on, WhatsApp us on, and call us on.
And
We
don't feel shy. So,
No man.
Sash
If
was
me do
shy,
it,
but she did feel
anybody
safe to
can do
chat.
it.
Yeah,
No man. If me do it, anybody can do it.
so you
and
can
don't it
reach out,
wasn't
guys.
that bad.
Girl, you had no idea. I dream about this every night for the past week. But it's really not
I
as
think I
as
think
bad as
Yogi's calling right on
Yeah,
time.
Yugi.
we got another call coming in straight out of caller your live.
Ice Princess Sinana Vodka. Good night. I know you don't have to put the yogi out there. That's a public name.
It's a private name.
A public name. But it was awesome listening to your story. And I must say, I'm sure you have been an inspiration to someone, maybe even one person or something. You never know. So I just want to give you a shout out. Big up yourself, big up yourself beside our same way. Capture.
Thank you.
Nana, just continue what you're doing and continue believing in your faith and continue to inspire people. And wonderful story. Have a wonderful night. These with the maze, big up to Noli and Chrissy. Great platform.
Thank you.
Blessings.
I appreciate you.
Blessings, Yogi.
Yo, one day Sash told me the story behind Yogi, right? And so I message Rocky and I say, "Hey Yogi." All Rocky say is, "Yeah, Sash a reason." Like automatically know who tell me.
Oh, we gotta say thank you to Jamaica Public Service for not cutting off
And
any light
lime.
It's
in the
true.
Yeah.
Don't it?
They did good this Sunday, for real.
Cause
Them
every
not
Sunday
going
when
too
we go
bad.
live, JPS cut off the
Yeah,
lights.
JPS is so
Right.
JPS, you mash up with life.
You know what? Yeah, come on.
Guys, thank you so much for tuning in. Oh, Sash, they wanted to know how old Riri is.
No?
Yes,
She's 2 years.
2 years.
Yeah.
Okay, guys. But
Okay.
thank you guys so much for tuning in. Sash, it was a pleasure having you. I appreciate you. Thank you for accepting the invitation to come on the live. And guys,
You're
to our
welcome.
lovely commenters and supporters and everybody,
Yeah, we
we appreciate you
y'all.
guys. So thank you guys for
Alright.
watching. And Sash, thank
Bye.
you.
Good night, guys.
Bye.
Gloops.
How are you saying? Leave.